it's Jules with Radio Now 100.9. Today, I am joined by Dr. Tamika Dawson from IU Health. How are you doing today?
I'm good. How are you?
I'm great. So nice to virtually meet you. And let's talk about the flu, because flu season is approaching.
It's here. It's coming.
Oh, my goodness. So what are some of the flu symptoms and what is the flu?
So the flu is a virus, as most of us have known. It's influenza. We've all gotten this as time has gone on. Our bodies have been exposed to the flu multiple times throughout our life. And so some of the symptoms are, fever, cough, runny nose, fatigue. And so those are the big ones that you tend to see. Sometimes you can even get a little nausea or vomiting with it. And so the flu symptoms are pretty much the same that you've always gotten. The big ones just being it feels worse than a cold. So if you can imagine just having a cold and it just being just a little bit worse, it's hard for you to get up. It's hard for you to move around. It's hard for you to do anything. And so those are the big flu symptoms that you have.
And when is peak flu season?
Right now. So
really?
So
that seems a little early.
I know it feels early, but technically it starts in September and lasts through the end of March. And so we have a huge flu season, which, kind of depends on when it kind of hits. It tends to be based off travel and what we're doing. And so, for instance, I've already gotten my flu shot. I got my flu shot a couple of weeks ago. So because I'm at increased risk, not only of the flu, but of COVID, because I have asthma. So I got my flu shot a couple of weeks ago. So I'm telling all my patients to go ahead and get their flu shots now.
We actually have that in common. I myself have asthma. And so you're recommending that anybody with those underlying conditions get the flu shot?
Yes, go ahead and get your flu shot now, because one, we've already seen, as you guys have probably seen on the news, that we doubled our COVID numbers over the last weekend. And so we went from 4.4 positivity rate to like an 8.8. And so we definitely don't want to have a flu plus COVID. So go ahead and get your flu shot. Most doctors' offices and CVS's and your local pharmacies already have a flu shot in stock. Go ahead and pick it up.
So how can we prevent getting the flu? Is the flu shot the number one way? Is that the easiest way?
Well, we have developed the flu shot, which is great over the years, but the best way is the same way we're doing with COVID. We're trying to stay away from people. What they've seen in studies that have been done in like Australia, their flu season has already started and their flu rates are significantly down because we're washing our hands, we're not touching things, we're wearing masks, because the flu is airborne. And so if you're doing all the things you're supposed to be doing for COVID, you're actually decreasing your risk of the flu as well.
And why is it so important to receive your flu shot? And how exactly does the vaccine work?
So the big thing right now is the importance of the flu shot is absolutely secondary to COVID. I offer the flu shot every year, but this year especially, I'm really trying to talk patients into it. And part of that is just to decrease your risk, especially when you already have comorbidities. And so some people don't know what comorbidities are. We already talked about us having asthma. So that's one. COPD is another. Hypertension, especially with COVID, is really hitting my hypertension patients a lot, even worse than my COPD and asthma patients, which I did not expect. And so making sure that you are getting your flu shot is going to help not only prevent the flu, but also prevent any multiple infections with COVID. And so that is our greatest chance of trying to beat this deadly virus that is out there right now. And so the flu shot essentially increases your antibodies. And so you don't get a live virus. It may increase response in you. And so people always say, well, I got the flu shot and I got symptoms of the flu. Well, it may make you feel a little not so good, but it's not giving you the flu. It's just building up that response in you. So if you were to be exposed to the flu, you already have antibodies which fight off viruses. And so that's the point of getting the flu shot. And so, yeah, some people do get kind of like this kind of hyper response to the flu shot, but you don't technically get the flu from the flu shot.
So we talked about some underlying conditions. Who should get the flu shot? Is there like a minimum age of, should kids get it? Should it be older people or should it just be everyone?
Everybody, every single person in your family should get the flu shot. My family is already, I've gotten my flu shot, and all of my kids and my husband are already due to get their shots next week. And so everyone from babies all the way up to your elderly grandparents. I have a 101-year-old woman who came in the other day and she got a flu shot. So everybody.
Is it safe? So you said that we sometimes feel like that we get sick from the flu shot, like we feel like the flu shot gave us the flu, but that's not really the case, right?
It's not the case. And so sometimes people will get like the sniffles or something, and that's really your body responding to the shot. But you don't technically get the flu from the flu shot. And so, yes, it's safe, it's effective, it's been around for multiple years. There's been multiple trials about the flu and getting the flu shot. And so it's safe and effective and a great way to prevent you getting the flu, especially during this COVID season.
Yes. And, obviously there's no COVID vaccine yet, but there is the flu vaccine. But does the flu shot help protect us from COVID? And can you get COVID and the flu at the same time?
So technically, yes, you can get COVID and the flu at the same time. So I'll start with that question. And so that is what we're trying to prevent. We're already, worried about people getting the flu and being intubated and being in the hospital, but you can get multiple viruses at the same time. And so making sure that we are protecting against at least one virus is really helpful as far as combating COVID. However, can the flu shot prevent COVID? No. And so that's a big thing because the flu can't prevent COVID. What we're trying to prevent is you getting sick from the flu, and then on top of that infection, getting COVID, which the flu already kind of makes you feel weak and builds an immune response in you anyways. And so you're already weak from that. If you were to get COVID, it would really take over. And so we really want to prevent you having two super infections together.
Yes. And can you kind of differentiate the symptoms of COVID and the flu?
So some of the symptoms are the same. And so some people get what we call mild symptoms. So some people from COVID will get kind of the same symptoms as the flu. You won't feel well, you'll be fatigued, you'll get a fever, you may have cough and runny nose. And so those tend to be the same. The big difference between COVID and the flu is that we have had the flu. The flu's been around before. Most of us have had it at least some point in our lives, whereas COVID is a novel virus. What does that mean? Well, we don't know how it's going to affect your body. So we put this novel virus that your body's never seen, your antibodies have never seen, and so we don't know how it's going to affect you. So it can be mild like the flu, or it can be severe where it's literally attacking your lungs and your blood system to the point of infecting your lungs to cause pneumonia, or even to the point of causing blood clots. So I've had patients who have been young and healthy with COVID who have actually gotten strokes because of blood clots.
Oh, my
so
goodness.
You just don't know how it's going to affect you.
Mm. And what's the best way we can protect ourselves? I know obviously there's a flu shot, but how can we protect ourselves from both the flu and COVID?
So biggest way, wash your hands. Wash your hands, stay away from people. If you're sick, stay home. Don't go around your family and your friends, especially your older relatives, because they're at increased risk. Making sure you wear a mask, especially when we're about to get cold. So that's the big concern. The big thing is that what we saw, that spike from 4.4 to 8.8 in positivity rate, is more than likely secondary to the fact that we're going inside more. We're inside more, it's colder, and so we're going to be around more people. And so making sure you protect yourselves and wearing a mask, washing your hands, using hand sanitizers, and staying home when you're sick are going to be your big takeaways.
Well, where can I get my flu shot?
So you can get your flu shot pretty much from any pharmacy, as well as your primary care's office or the health department. And so going ahead and getting your flu shot. We're also going to be doing some community drives, kind of bringing the flu shots to you and your community. So look out for some of that stuff that's coming.
Is it free? Is it expensive?
So a lot of people are giving free flu shots, and no, it's not expensive. And 9 times out of 10, your insurance companies will pay for it. If you're one of the unfortunate people who have lost their jobs, look for some of these free clinics that are going to be popping up throughout your community to try to get your flu shot taken care of.
Well, thank you so much for joining us today, Dr. Tamika. Is there anywhere we can find more info about the flu shot?
So go ahead and go to www.iuhealth.org, and there is plenty of information there. You can also go to your local primary care doctors, and I'm sure they have plenty of flyers and information that's around in their offices.
Again, thank you so much for taking time out of your day to inform us all about the flu shot. As always, you can listen to us live at radionowindy.com, download the Radio Now app, or tell Alexa to open Radio Now 100.9.